Are you sneezing, wheezing? Are you just miserable? I can tell you, you are not alone. I am with you. September is peak allergy month, and that is why we are talking with Dr. Joel Gallagher with Cone Health Allergy and Asthma Center of North Carolina about how to manage your fall asthma and allergies. All right, so let's get right to it. Why are we seeing this spark in September?
Well, the first week of September, Tanya, is often referred to in our business as peak week, and that's for a very good reason. We have a couple of things coming together. One thing is all of the kids going back to school, sharing germs, and viruses and colds are a big trigger for a lot of asthmatics. We also have the peak of ragweed season. That started in about mid-August. You might have felt your sniffles getting a lot worse then, and it kind of stays stable through the first hard frost, which, as you know, can be the middle of November. So we've got about 3 months total of suffering from ragweed.
Oh
So those
no,
two
I was
things
hoping you were not going
together.
to say that.
Sorry, I'm not your friend today, Tanya.
But you are, because you're going to kind of help us out. So let's talk about how we can reduce our exposure to these kind of allergens.
Okay. So that's always a really good question that we get. So in a typical day, the pollen levels in the air go up during the morning and stay stable through noon and then go down in early evening. So if you can try to focus your activities in the early morning or the later evening, your pollen levels that you'll be exposed to will be a lot lower. Another good thing to do is to get a HEPA filter for your whichever room you stay in, or just a whole house filter. So that's a high efficiency particulate air filter, and that captures all the pollens and prevents them from interacting with your immune system and causing allergies.
Okay, so we need that HEPA filter in our bedrooms to
Yes.
make sure that we can wake up and
Yes.
feel a little
Yes.
bit better. Gotcha. All right, so let's talk about the difference between asthma symptoms and allergy symptoms.
So this is a common question that we get. So asthma really only focuses on the lungs. So it is inflammation of the airways, mucus production of the airways that really constricts the air movement through your lung tubes. And that causes things like coughing, wheezing, chest tightness, and shortness of breath. Allergies can affect the entire airway from the nose all the way down to the lungs. So people with allergies often have asthma, but they don't necessarily go hand in hand. But
Okay.
patients with asthma are triggered by allergies. So there's a lot of interconnectedness there.
Okay. How can people tell? Oh, so you kind of told the difference about how you can tell the two, but how would someone know if the symptoms that they're experiencing are, let's say, COVID or asthma or allergies?
It is hard. There's a lot of overlap between all of those symptoms. So early in the pandemic, we actually, had a mask mandates everywhere because we couldn't tell if something was COVID versus asthma or allergies. But now that we have testing, we're able to distinguish that a little bit more. So both COVID and asthma and allergies have the congestion, the headaches, the coughing, the tightness in your chest. But allergies and asthma usually aren't presenting with fever. So if you have a fever, that's more likely an infectious process like COVID-19 or the common cold. Also, if you have GI symptoms, that's probably not allergies or asthma.
Okay, gotcha. All right. So once you've determined, let's say that it is asthma versus allergies, what are some ways to manage those symptoms?
So if you're diagnosed with asthma, our main set of treatment options right now are focused on inhalers. So if you have mild asthma, we'll probably just give you something called albuterol or a rescue medication, and that's a short-acting medication that opens those lung tubes up and helps you breathe quickly. And if your asthma is severe enough, we'll put you on everyday medications. They usually consist of inhaled steroids that control the inflammation on the layer of the lungs to prevent all that mucus production and hyperreactivity and inflammation. So between those two treatment options, we are able to control those asthma symptoms.
All right, like anything else, right? Sometimes you know that you're diagnosed with something and you're like, I'm okay, it's mild or whatever. How important is it for people with asthma to have a plan of action?
Oh, the plan of action is huge. Our goal as allergists is to keep you out of the emergency room and out of urgent care. So we provide all of our patients with a written plan on what to do when they start having asthma symptoms. That depends a lot on patients knowing what their triggers are and how they usually present. So we will have patients start taking an inhaler like a albuterol, every 2 to 4 hours when they first start having symptoms, and use that consistently for a few days as they get over whatever is causing their exacerbation, such as a cold or a allergen exposure.
Okay. All right. So we're going to continue to talk about allergies and asthma, things you should do, things you shouldn't do, and all that other kind of jazz. We're going to continue that conversation in just a